today?
I'm feeling pretty good.
Oh, good. Okay, so I'm here to do an assessment on you. Is that okay?
Uh-huh.
All right. Okay, so do you mind if I slip the head of your bed up a little bit?
Not at all.
Do you have any pain anywhere?
Right here in my stomach, it hurts a little
Your
bit.
stomach hurts? Can you rate that pain on a scale of 1 to 10 for me?
Probably like a
A
5.
5 out of 10? Okay. Alright, so the first thing you're going to do is a full set of vitals. Starting with blood pressure, so I'm going to do your blood pressure, and then TPR, so temperature, pulse, respirations, and then your pulse ox. And then I am going to do pain, so that was what my pain was. You said it's 5 out of 10. And you start from the H-E-E-N-T, right?
Mm-hmm.
Okay, so I know this might be kind of weird, but I need to grab your head a little bit. Is that okay? I'm just going to feel for any lesions or... So you look for anything like crusty, any cuts, any misshapen, like if they've had like a lobectomy or something and everything feels good. Okay, you can lay your head back down. Thank you. And then I'm going to remove your glasses for just a moment. Is that okay? So you document that the patient uses eyewear. Do you have any hearing aids in, Mrs. Johnson?
No.
Okay. Okay, so I'm going to put this light in your eyes, and I'm just going to look, so you just look straight forward, okay? So 10 inches away. 10 centimeters, 10 inches. 10 inches.
It doesn't state.
So we go from out, back, okay. Perfect. So pupils are equal, round, reactive to light. Here's your glasses, Mrs. Johnson. Thank you.
Thank you.
Okay, I'm just going to look in your ears a little bit, see if there's any earwax build up. Nope, everything's good. Okay, so I'm sure they have a badge. This was just... Can you read this for me? Will you read this for me, please, Mrs. Johnson?
No.
Oh.
Read this for me.
Read this for me, please, Mrs. Johnson.
Salt Lake Community College student nurse.
Okay, cover your right eye, please. Read it again for me.
Salt Lake Community College student nurse.
Now cover your left eye and read it for me.
Salt Lake Community College student nurse.
Okay. 1, 2, 3. Did you hear that?
Yes.
What did I say?
1, 2, 3.
Perfect. Okay, can you open your mouth for me? Okay, stick your tongue out and say ah. Tongue up. Alright, gums are good, everything's good. Wonderful. Okay, Mrs. Johnson, now I'm going to check your apical pulse. Do you know where that is?
No.
That's checking it on the heart directly, so I have to reach up your shirt. Is that okay? Is that something you should put gloves on for? Or do you do
It's what you're comfortable with.
I'm clean patient.
I think she said the one thing that she would put gloves on for is for the head, and then Deborah Smith was feet.
Okay.
So
I would do feet for sure.
Probably feet for sure. Okay, so I'm going to find it first. Sorry, friend. Okay,
Don't
so
even
it's
care.
between the
Do you have to explain?
4th and 5th intercostal space, mid-clavicular line on the left anterior chest.
Mhm.
So that's your clavicle. So 1, got 2, 3, no wait, 3, 4, so it's like right here, right? Okay. Sorry, Mo.
I don't care.
It has to be directly on skin. Sorry. Oh. Sorry. I'd be the worst doctor ever.
It's okay. I think it's just gonna be cold no matter what.
This is
Can you hear
hard.
it?
No, I don't want to like reach around down there.
just ask her to lift up her boob.
Yeah, will you lift your breast up, please, Mrs. Johnson? 83. Okay. So you have to listen to that for a full minute, which is what I do. Okay, so head, ears, eyes, nose, throat, and maybe apical pulse. And then breath sounds, right, on the front. And it's 6 to 8. Okay, so every time I'm going to move my stethoscope, I'm going to have you breathe in, breathe out, breathe in, breathe out, okay?
Do you want to sit me up when we do breath sounds, or is that
I'll
just the
sit you
back?
up when I do your back.
I think that
And
question
you
was
want
on
it
the test, and I
skin,
didn't know.
So,
I didn't know either.
I said I think that question was on the test, what she just asked, and I didn't know.
okay, so you want it not on bones, like right here. So breathe in and out. Breathe in. Breathe out. And then, like right here, right? I don't know where it goes. Is it 1, 2, 3, 4, 5, 6? That's the abdomen.
You would go more out.
Like out?
Yeah.
Like here? Okay. So 1, 2, and then 3, 4.
Mhm.
Because boobs get in the way.
Yeah.
If it's on a guy, then it's most likely would be 8 on
Mhm.
Okay, so let's try that again. So breathe in. Breathe in. Breathe in. Like that. Yeah. I can actually. Okay, one more time. Okay. Now can you sit up and I'm going to do your back? Thank you. So there's 10, 12 on this. Does it matter if we do zigzag or box?
She said whatever you wanted to do.
Okay, perfect. Okay. So, you feel for the scapula.
My back.
It's fine. So you feel for the scapula because you want to be in between. So, okay, in, out. Good.
When I laid on your bed and you pushed against my feet with your feet, I'm not going to
Or anything that time.
But other than that, but well, that's and I mean,
In.
once I get going,
Okay, in,
No, it's in the drawer.
in, in. Down there you won't hear it.
Yeah, I don't think you'd hear anything down there. It's like her kidney.
It's like here to here.
Yeah, you would want to do it. So the lower you get, the farther out you want to get.
Okay.
Carly's birthday was last week, and so we're going out for her birthday on Friday. You guys want to come? Because she's 21 now. Are you 21?
Not till
We're still going out. I think we're gonna go
Yeah, what
to like Gracie's, and then I think we're gonna